Hi, welcome to the 2024 Annual Benefits Enrollment presentation. Here's what we're going to go over today. We'll start with an enrollment timeline, a reiteration of the diocesan health goals, a review of our medical insurance offerings and coverage changes, some information about our new dental vendor, and then, although it's not technically part of annual enrollment, we'll review some of the supplemental retirement benefits, including the introduction of a Roth 403b. So the timeline. In mid-October, annual enrollment packets will arrive in the mail. In fact, at the time of this recording, I believe probably most of you will already have received those packets. If you're worried that it might be in a pile of mail somewhere, just look for a pale green envelope. On October 25th, annual enrollment will begin, and you can log in to cpg.org and look for the My CPG link to get started on that. During annual enrollment, all current plan members can choose a new plan. Eligible non-participating employees have the option to join a plan. Eligible non-participating dependents may be added, and participating dependents may be removed. If you're a non-participating employee currently, you won't be able to participate in online annual enrollment. You'll have to enroll using paper forms. So please be in touch with me or with Kim Christopher to obtain those documents. Annual enrollment ends on November 15th, and on January 1st, 2024, the new plans will take effect. Please know that in prior years, if you wanted your coverage options to remain the same, you don't really have to participate in annual enrollment. We recommend it, but it doesn't really matter. This year, because our dental vendor is changing, you must participate in annual enrollment if you wish to keep your dental insurance, because you cannot stay on your current plan, and you must select a new one. So to review the diocesan health goals, we desire for our clergy and lay employees physical, mental, spiritual, and financial health for our plan participants. So our plans are designed to encourage participants to get preventive care, to take dental care seriously as part of your overall health, and finally to lead to predictable financial outcomes so that a health crisis does not also become a financial crisis. So just a quick overview of what our plans cover. We cover currently 227 employees and 87 dependents. And over the last year, diocesan plans paid out $3.65 million in claims. So what's different in 2024 versus 2023? Well, no new medical plans are being offered or removed, but the existing medical plans have new features. Our dental vendor is changing. We are moving from Cigna to Delta Dental. You must select a new plan to retain coverage. So the medical plan coverage changes. As we are moving into a world where we're just going to be living with COVID, the waiver of copays and deductibles that was started at the beginning of the pandemic for COVID-19 testing and treatment ends. So your plan will still cover COVID-19 testing and treatment, but it now will be subject to copays and deductibles. You will still have free over-the-counter COVID tests available to you, but the terms are changing. If you select a PPO plan, you can receive up to 4 tests per month by mail with no cost share. Those who choose the high deductible plan, or the CDHP, can receive up to 4 tests per month at no charge, but you must meet your deductible first. Finally, deductibles for the CDHP, those are the high deductible health plans, will increase. That's not due to the medical trust being mean or stingy, but it's simply that the IRS regulations have changed, and so the minimum deductible required for a high deductible health plan has risen.
So here are the plan highlights. We're offering 4 plan designs this year, although if I am candid with you, the plans are designed to incentivize you to choose the first column here, the CDHP 15 Health Savings Account plan. So that plan has a deductible, and I'm focusing here on in-network coverage of $1,600 for an individual and $3,200 for a family. The out-of-pocket maximums don't change, even though the deductibles have. So the out-of-pocket maximum, that is the maximum amount that you would pay for covered services, provided you stay in network, is $2,400 for an individual and $4,800 for a family. And importantly, the entire deductible will be covered by the diocese in the form of an HSA contribution. So that's $1,600 for an individual and $3,200 for a family. The CDHP 20 HSA plan we mainly have as an accommodation for cooperating ministries who need a cheaper plan. So you are permitted to choose this plan if you want. It's a little bit cheaper, but the coverage is not as good. So the deductible is $3,200 for an individual and almost $5,500 for a family. Out-of-pocket maximum $4,200 for an individual and almost $8,500 for a family. The employer HSA contribution, we will not cover the whole deductible in this plan. We'll only cover the amount that you would get if you were in the CDHP 15 plan. PPO 80, the economics of this plan can be more attractive for people with certain medical needs, and the deductible on those plans is a bit lower, $1,000 for an individual, or $2,000 for a family, and out-of-pocket max of $3,500 for an individual and $7,000 for a family. If you're in this plan, you are not eligible to participate in a health savings account. And finally, we have the PPO 90 plan, which is available to eligible Medicare enrolled employees only. And the reason we offer this plan is that it's got the economics that are most similar to the CDHP 15. So we don't want to penalize plan participants who don't access the CDHP 15 anymore merely because they've enrolled in Medicare.
So this slide is here just to give you a picture of what our overall plan costs are. So these are the full monthly premiums. And I think probably your takeaway from here is that medical insurance is really expensive. So our most expensive plan, the family PPO 80, the full cost is about $36,000 per year. I won't belabor this point. You can feel free to hit pause if you want to study these in more detail. This is the employee share, so what you will pay. In 2024, diocesan clergy and lay employees will pay 24% of the medical insurance premium via payroll deduction. So these are the monthly amounts that will be withheld from your paycheck. Please hit pause if you wish to study them. These amounts are up roughly 7.5% from last year.
Okay, so a quick look at the general coverages that are offered in our medical plans. So preventive care, screening, and immunizations, including travel immunizations, are available at no charge, provided you stay in network. And the other primary care and specialist visits, diagnostic tests and imaging, you'll see a pattern here. CDHP 15 will offer 15% coinsurance. CDHP 20 is 20% coinsurance. And then with the PPO 80 or PPO 90, there'll be a mix of copays and coinsurance. In PPO 80, your coinsurance will generally be 20%. PPO 90, the coinsurance will generally be 10%.
The plans do cover inpatient and outpatient hospitalizations, including maternity care. An important thing to note is that for emergency room care, the plans cover in-network and out-of-network emergency room visits when it's a true emergency at the same level. So the plans are designed to make sure that if you are in an emergency situation, a car accident, heart attack, something like that, you just get to the nearest place that can provide the services you need. Same for ambulance services. That used to also be the case with urgent care, but the plan has changed a bit this year. The plan covers out-of-network urgent care more generously than it covers other out-of-network services, but it's still designed to encourage you to seek in-network care when you might visit an urgent care center for minor illnesses and injuries, things like that. The plans cover a variety of rehabilitation and home health care services, including hospice, skilled nursing, rehab. There are up to 210 home health care visits per year and 60 rehabilitation service visits per year. The plan does cover outpatient and inpatient behavioral health services. Then the plan also covers prescription drugs. That's through Express Scripts as the primary vendor. There have not been any significant changes in how in the pricing of the drugs this year, although there have been minor shifts in the PPO 80 and PPO 90 plan that have not really raised costs so much as simplified the cost structure. There are pretty strong incentives for you to choose generic drugs. It's also notable that many specialty drugs, those are some of these really groundbreaking treatments for cancer and things like that, may require prior authorizations. The medical and prescription plan share a deductible, so you don't have to meet deductibles independently. And if you're on a prescription for longer than 90 days, the plan does force you to shift to mail order for most prescriptions. So additional coverages, all of the plans include telemedicine services. That's both through Cigna's MD Live platform, as well as virtual visits with your primary care physician, if that's something that they offer. There's also an employee assistance program embedded in the plan that covers you and your household members, even if your household members aren't on the plan. The EAP is most commonly accessed for emotional and behavioral health issues, but it can help with other routine day-to-day problems, such as finding pet care, elder care, caregiver support, legal services, things like that. When it comes to behavioral health, the EAP covers 10 visits per issue. So if you need, say, grief counseling early in the year and anger counseling later in the year, you would get 10 visits for each of those issues. Health Advocate can assist most commonly with navigating disputes with insurers about covered services. So typically, if you call me about a dispute that you are having with Cigna about whether a service should be covered, I'm going to ask you to call Health Advocate as your first stop. So you can access that service by going to healthadvocate.com, looking for the login link, and start typing Episcopal, and Episcopal Church Medical Trust will eventually auto-populate. Just click on that and then follow the instructions from there. The other way Health Advocate can be useful to you right now is that they can assist you in selecting the plan that is right for you. So if you're not sure if the CDHP or the PPO 80 makes most sense for you, just contact Health Advocate and they can assist you with that. Similar to the EAP, Health Advocate covers the beneficiary, household members, parents, and in-laws, even if they are not on the plan with you. Our health plans also offer vision benefits through the iMed Insight Network. New to the plan towards the end of last year is Hinge Health. That's a virtual musculoskeletal clinic whose programs include prevention, exercises for chronic pain and acute injuries, and assistance with pre- and post-surgery rehab. So the goal of Hinge Health is kind of to help you see if you're having musculoskeletal issues that might be leading you towards shoulder or knee surgery or something like that, to provide you with supportive services, either to prevent you from needing that surgery or to maximize the probability of success. Finally, two other items the plan covers that are not listed here, but some people wish to know about, is that the medical plan does cover fertility treatments up to a $50,000 lifetime maximum, and that's combined both physician services and prescriptions. And the plans also do cover gender-affirming care. So I mentioned earlier incentives for you to get your preventive care visit. In 2024, diocesan clergy and lay employees will share 24% of the medical insurance premium versus 23% in 2023, unless The primary beneficiary of the plan demonstrates proof that you've received your preventive care services, that's your free wellness visit, in calendar 2024. In that case, 1% of the full premium will be rebated back to you. And even though 1% doesn't sound like a lot, health insurance is expensive, so the benefit is worth approximately $100 to $350 depending on the exact plan you're in. Proof of receiving that visit can take the form of a doctor's note. We have a template available on the diocesan website under the compensation and benefits page, or you can provide an explanation of benefits from the Cigna website. You are not being asked to provide any personal or confidential health information. We only want proof that you have received your free preventive screening. Proof has to be submitted by January 15th of 2025 in order to be eligible for the rebate. We'll generally try to issue those rebates in December as a kind of Christmas bonus. Okay, dental benefits. So we are changing vendors, but we are not changing prices. So these are the full monthly premiums. There has been no change from the premiums on the roughly equivalent plans last year. The diocese will cover the first $41 of coverage. That's essentially a single beneficiary's premium for the Delta Basic PPO plan. And then you can purchase coverage for additional beneficiaries and or a higher tier of coverage at your own expense. So the new vendor, Delta Dental, we believe that for most plan participants, this will be an improvement. That's partly because Delta Dental has a larger network of dentists than Cigna does, so we anticipate there will be minimal disruption to your networks, although we can't promise there will be no disruption. The other attractive thing about this plan is that particularly if you stay inside the Delta networks, either the PPO network or the Premier network, the maximum annual benefit generally increases by about $500 per year compared to what we had with Cigna. There are also a couple of significant positive differences when it comes to major services. So those are things like crowns, bridges, implants. It used to be that there was no coverage whatsoever for those services inside the basic PPO plan. And at this point, there is now 60% coinsurance in network, which is pretty attractive comparatively. And so it makes the decision between the comprehensive PPO and the basic PPO, those are a bit more competitive with one another than they used to be. Also notable is that you used to have to be in the premium plan to be eligible for any coverage for orthodontic services. The premium and comprehensive plans now both offer orthodontic coverage, albeit at somewhat different benefit levels. Even though it's not officially part of annual enrollment, this time of year is a good time to evaluate where you are with your retirement savings. So your pension, if you're clergy, generous as it is, may not be enough to support you in your retirement, and so it's a good idea to supplement it through participation in the clergy RSVP plan or the lay 403B plan. Consider enrolling if you haven't already. You can speak to your parish administrator about that if you're not sure how, and if they're not sure how, you can just talk to me. Also, you can consider increasing your pre-tax contribution. The 2023 contribution limits were $22,500 per year, with an additional $7,500 available as a catch-up contribution for participants who are 50 years or older. The IRS, as of the date of this recording, hasn't yet released the 2024 limits. There's a new feature in the plan in 2024, namely a Roth 403B option. Unlike the standard RSVP or 403B plans, this is funded with after-tax rather than pre-tax dollars, but it offers the advantage that when you withdraw funds from the Roth 403B in retirement, they are completely tax-free. And unlike a Roth IRA, where there are salary caps that can make you ineligible to contribute, The Roth 403B has no salary cap, so everybody is eligible to participate in this. You can split 403B contributions between pre-tax and Roth accounts in any proportion that you choose. I have to say that even though the Roth 403B, it's nice to have this option, it's not necessarily clear-cut about whether the traditional option or the Roth option is going to be more attractive for plan participants. So particularly for clergy, this would be a good time to take advantage of the financial planning services that we offer through the Ministerial Excellence Fund. If you have questions about that, please be in touch with me. If you do choose one of the CDHP plans, you have a health savings account available to you. Now, the diocese will fund the amount of the deductible for the CDHP 15 plan and will fund a significant amount of the deductible if you're in the CDHP 20. You can supplement that employer contribution to the HSA with your own pre-tax contributions. So the 2024 contribution limits, which include the employer contribution, is $4,150 for individuals, $8,300 for families, and if you're over age 55, you're eligible to contribute an additional $1,000 as a catch-up contribution. Health savings account funds, unlike the flexible savings account you might be familiar with from other employees, or other employers rather, are your money forever to be used for medical purposes. So you don't forfeit any funds that don't get spent by the end of the year. So summary, annual enrollment begins on October 25th and concludes on November 15th. Go to cpg.org and look for your My CPG account and log in to begin enrollment. This is your chance to make changes or enroll for the first time without having a qualifying event. If you need help deciding, go to healthadvocate.com, click login, and start typing Episcopal and look for Episcopal Church Medical Trust to pop up. Follow those instructions on the website and Health Advocate can assist you. Your new plans will become effective on January 1st, 2024. You'll probably receive your new insurance cards a few weeks in advance of them. Thanks so much for participating in this presentation. If there are any questions, please just let me know. You can reach me at brendan@indiedio.org. Thanks so much, and remember, participate in annual enrollment or you might lose your dental insurance. Take care.